Like to call the House Health Committee to order. Would the clerk please open up the board, take the roll?
Present.
All right, will the clerk please take the roll?
Mr. Chairman, you have 19 members present. You have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? All right, I don't know if he's in here or not. Is our doctor of the day, Dr. James Haynes, in here? There he is. All right, welcome, Dr. James Haynes out of Ooltewah. Thank you for being with us. Have a few housekeeping items before we get to the calendar. Item number 3, House Bill 2459 has been taken off notice. Item number 27, House Bill 1936 has been taken off notice. And item number 7, House Bill 806 has been rolled to the hill. 1806 has been rolled to the hill. And so we're going to go a little bit out of order. We've had, with some things that have gone on, we're going to try to get to some folks that are not on the committee. We're going to try to get to some of those bills that have testimony, and then there have been a few bills and folks that have been stuck here for a few weeks that we've not been able to get to, and so we're going to try to get to those bills as well. So let's see, we're going to start with item number 29. So that would be House Bill 1835 by Representative Hale. You have a motion and a second. You are recognized. Do we have an amendment? Okay, there is no amendment, so you are recognized.
Thank you, Chairman and Committee. House Bill 1835 would require the Department of Human Services to apply for and, if approved, participate in the Summer EBT program. Summer EBT is a federal program that provides families of children on free and reduced lunch with $120 for meals over the summer. This program would feed nearly 700,000 children across all 95 counties. It's aimed at feeding the children and providing for their needs.
All right. Do we have any questions for the sponsor of the bill? All right, seeing none, will the clerk please open the board for the vote? All those in favor vote aye. Those opposed vote no. Clerk, please take the vote.
Mr. Chairman, you have 17 ayes, 0 nays.
All right. House Bill 1835 passes and moves on to Finance, Ways and Means.
Thank you, Committee and Chair.
All right, thank you. All righty. Let's see. Is she here? Not here? Okay. All right, I was going to try to get through the first 10 bills here. Item number 4, I don't see her here, so we're going to go to item number 5. House Bill 1909. Chairman Hicks, you have a motion and a second. You are recognized.
Thank you, Mr. Chairman. I do have an amendment, 016297, makes the bill.
You have a motion second on 016297. Okay, let's go ahead and vote on that. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
All right, thank you. This bill was brought to me by the Tennessee Association of Marriage and Family Therapy. This association represents the interests of licensed marriage and family therapists across the state of Tennessee. The amendment actually made some technical corrections and, again, rewrites the bill. The changes in this bill will have a meaningful impact in the industry. Right now in Tennessee, the demand for mental health support and services is extremely high. Virtually all of Tennessee is rated as a mental health provider shortage area. Tennessee lags behind in most other states regarding mental health providers per capita, ranking 44th in a recent study. Nationwide, there is one mental health provider for every 350 individuals, but in Tennessee, there is only one provider for every 590 residents. House Bill 1909 proposes several changes regarding marriage and family therapists in Tennessee to help address these issues. This bill will address portability challenges, also encourage new graduates to work in community mental health and similar high-need settings. Also, it modernizes terminology. Also, it adds clarification to the licensed marriage and family therapist definition and revises board-approved supervision requirements. And again, the effective date takes place on July 1st, 2026. Mr. Chairman, I stand to answer any questions.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, will the clerk please open the board for the vote? All those in favor vote aye. All those opposed vote no. All right. Will the clerk please take the vote?
Mr. Chairman, you have 17 ayes, 0 nays.
All right. House Bill 1909 passes and moves on to calendar and rules as amended. All right. That brings us to item number 6. Okay. That is House Bill 1534. Representative Shaw, you are recognized. And
Thank you, Mr. Chairman. I believe, did we get the amendment on 01555 last week?
We will have to put those amendments on. There are 2 amendments, I believe.
Okay.
There's one that rewrites the bill and one that, is that correct? Yeah. Is that, do you want to put both those amendments on?
Yes,
In order?
sir.
Okay. All right. So we have amendment drafting code 014025. Is that what you have?
Now the one I've got 01555.
That's the second amendment.
That's the second
The
amendment.
first one makes the bill and the second one,
Okay. I'm looking for the other one. I didn't think that there was but one to go on. Give me that number again.
we have one 014025.
Mr. Chairman, I have to be perfectly honest with you, I don't see that amendment. Okay. Thank you. Yes, sir. I have it.
You have it?
I do.
Okay. All right. Can I get a motion? Motion is second on 014025. Okay.
Yes, sir.
All those in favor say aye. Opposed? Ayes have it. Okay. And then the second amendment is 015555.
Yes, sir.
Okay. Motion and a second.
That's correct.
Okay. If there's no objection, we'll go ahead and put that on. All those in favor say aye. Opposed? Ayes have it. Okay. We are back on the bill as amended, and I would move that we roll these into one amendment if this bill passes. You are recognized, sir.
Thank you, sir. That's correct. The second amendment just simply changed one of the words in the bill. Was it changed it from scholarship to resource? That's all the second amendment does. First amendment that we put on is what actually makes the bill. This is the stillborn baby bill. And what it is doing, it is asking that the health department administer services for ladies who have stillborns and their maternal needs. Basically, is what this bill does. So with that explanation, I stand for any questions.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none. Okay. We are going to be voting on House Bill 1534. Will the clerk please open the board? All those in favor vote aye. All those opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
All right. House Bill 1534 passes and moves on to Finance, Ways and Means as amended. And then we rolled 7 to the heel.
That is correct.
That's
And Mr. Chairman, if I may, that is the same bill that Representative Hale has. And I think we talked about just putting those two together. So what I'll do is I can take that bill off notice and just sign on to his bill.
All right, that sounds like a plan. So House Bill 1806, without objection, will be off notice.
Thank you, sir. Thank you, members.
Thank you. All right, that brings us to item number 8, House Bill 1943. You have a motion and a second. Yeah.
Thank you, Mr. Chairman, committee members. I think there's an amendment traveling with it or needs to be attached. I'm not sure.
Okay, there's one that came out of, that was Subcommittee 015486, is that correct?
Correct.
Okay, I need a motion. Can I get a second? Okay, motion second, okay. And this is the one that came out of Sub, is that correct? Okay, all right. Let's go ahead and get that on the bill. All those in favor, say aye. Opposed? Ayes have it. Okay, we're on the bill as amended. And was there a different amendment you were going to use or just going to use that one?
Just use this one.
Okay.
Yes, sir, Mr. Chairman. Mr.
right.
Chairman and committee members,
You're recognized.
thank you. This piece of legislation would simply instruct hospitals, emergency rooms that they need to provide stabilizing care and screening for women who are pregnant. And again, we came out of the subcommittee with language that specifically says that this does not authorize abortions. And so we just want to make that clear as members had questions about that in the subcommittee.
Okay, do we have questions for the sponsor of the bill? Okay, I did have one thing that I did want to ask. It was brought to my attention that the way that, we'd had this discussion before, but the way that this is in, my understanding is that if there's not duplicative, I guess, I don't want to say punishment, but duplicative against a physician if they violate EMTALA. So the state can't violate, or the state cannot sanction them if it's done at the federal level. Is that correct?
Correct. And I think that is in section J of the amendment where it says a civil penalty or licensure sanction shall not be imposed under the section for conduct that is subject of an enforcement action, settlement, corrective action, plan, or final determination under the Federal Emergency Medical Treatment and Labor Act.
Okay. And it's not your intent that for the physicians that are following EMTALA, for this to be an increased burden on them from the state. Is that correct?
Correct, Mr. Chairman.
All right, thank you. All right, any further questions for the sponsor? All right, will the clerk please open the vote? All those in favor vote aye. All those opposed vote no. Where's this bill going? Okay. All right, will the clerk please take the vote?
Mr. Chairman, you have 13 ayes, 0 nays, 5 present not voting.
All right, thank you. House Bill 1943 passes and moves on to calendar and rules as amended.
Thank you, Mr. Chairman and committee members.
All right, and I think you've got 2 more on our calendar today. Is that correct?
Yes, sir.
All right, let me get all my paperwork together here. Okay, item number 9, House Bill 1944. You have a motion and a second.
Thank you, Mr. Chairman and committee members. This piece of legislation simply would codify that the Department of Health would test and inform parents if their children have the presence of sickle cell trait.
All right. Do we have any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 1944. Clerk, please open the vote. All those in favor vote aye, opposed vote no. All right, will the clerk please take the vote?
Mr. Chairman, you have 19 ayes, 0 nays.
House Bill 1944 passes and moves on to calendar and rules.
Thank you, Mr. Chairman and committee members.
And I believe you have number 19, is that correct?
Yes, sir.
Let me find it on here. House Bill 2415. Okay, excuse me, 2413. Okay, you have a motion and second on 2413, and do we have an amendment? Amendment that rewrites the bill, drafting code 015392, is that correct?
Yes, sir, Mr. Chairman and committee members.
Okay, you have a motion and a second. If there is no objection, let's go ahead and vote on that. All those in favor vote aye. Opposed, vote no. Ayes have it. We are back on the bills amended. You're recognized.
Thank you, Mr. Chairman and committee members. TASER did a study on child care centers and discovered ways that we could increase the number of child care centers, and centered around really reducing redundancy in some of the procedures. And this legislation simply seeks to pick up some of those recommendations that TASER gave in their report and put them into law. And you'll find those in there around safety inspection with the fire marshal, and also about the ability to use other sites for child care centers.
All right. So do we have any questions for the sponsor of the bill? Chairman Williams, you're recognized.
Thank you. Thank you, Representative Love, for this bill. Obviously, anytime we can improve the access to child care in our state, I think it's really important. However, I do serve on TASER, and I don't remember from subcommittee, I meant to look, I don't remember that being a recommendation of the committee. I completely trust it would be, but if you don't mind, just send me that language, would be great. Thank you.
Thank you.
All right. Any further questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 2413. Will clerk please open the vote? All those in favor vote aye, opposed vote no. All right, will clerk please take the vote?
Mr. Chairman, you have 17 ayes, 0 nays, 1 present not voting.
All right, House Bill 2413 passes and moves on to government operations as amended.
Thank you, Mr. Chairman and committee members.
All right, thank you. I'm going to go back to item number 4, House Bill 1040 by Representative Jones. You are recognized.
Thank you, Mr. Chairman. What this bill, the amendment code is 1015804.
We have a motion and a second on, let me find it here. There we go. What did you say the drafting code was?
015804.
Okay. All right, you have a motion and a second. All those in favor say aye. Opposed? Ayes have it. You're on the bill as amended.
Thank you. What this bill would have done would be to create a board of professional sign language certification. And we know that this body feels that that was important because we passed this years ago for education, that our deaf interpreters needed to be certified in order to be in our schools. This bill would have created as a statewide interpreter certification program. I'm going to ask to take this off notice. It is not in proper posture right now to move forward with, but we'll be looking to bring this forward in the future. But I just appreciate the patience of running this through committee and the process, and thank you all for allowing me to present this.
All right. Thank you. Without objection, House Bill 1040 is off notice. Thank you.
Thank you.
All right, let's go back to item number 10. House Bill 1950 by Chairlady Rudder. You are recognized. You have a motion and a second.
Thank you, Chairman. This bill allows for qualified speech language pathologists to start working before their Tennessee license is officially issued, reducing wait times for patient care. To practice during this period, the necessary examinations must have been passed. This legislation would remove the requirement that SLPs must be members of the American Speech Language Hearing Association to acquire a Tennessee state a license. If passed, the state board cannot force applicants to hold an ASHA certificate as a condition for obtaining licensures. Why this matters is for easier hiring by letting qualified professionals work while their paperwork is pending. Schools and hospitals can fill critical therapy roles more quickly. It also lower cost. It would prevent the state from requiring professionals to pay for private national certifications if they already meet the state's education and testing standards. That is my bill, and I stand ready for questions.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we're going to be voting on House Bill 1950. Will the clerk please open the vote? All those in favor vote aye. Opposed, vote no. The clerk, please take the vote.
Mr. Chairman, you have 20 ayes, 0 nays.
All right. House Bill 1950 passes and moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
All right, thank you. And so I'm going to go out of order here. We're going to take up item number 16, House Bill 2353 by Chairlady Littleton. You have a motion and a second? You are recognized.
Thank you, Mr. Chairman.
And do you have an amendment?
I do have an amendment 14130.
Motion is second on drafting code 014130. If there's no objections, all those in favor say aye. Opposed, ayes have it. We're in proper form. You are recognized.
Thank you, Mr. Chairman. We're calling this the Safe for Kids Act. It requires that the Commissioner of the Department of Human Services to establish a pilot program which will begin July the 1st, 2026 and end June 30th, 2028 to strengthen payment integrity, fraud detection, and oversight of publicly funded child care payment assistance program payments. Specifies that is the intent to fund the pilot program by using available reserve funds from the Bureau of TennCare that are designated for actual stabilization, payment integrity, or program oversight purposes. Requires the Commissioner to enter into the agreement with a qualified third-party analytics or oversight vendor to support payment integrity functions. We're bringing this bill as a response to the child care fraud that was uncovered in Minnesota.
All right. Do we have questions for the sponsor of the bill? All right. Seeing none, will the clerk please open the board? All those in favor of House Bill 2353 as amended, vote aye. Those opposed, vote no. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
House Bill 2353 passes and moves on to government operations as amended.
Thank you, Mr. Chairman and Committee.
All right, thank you. That brings us, we're going to go to item number 17, House Bill 1495. I have a motion and a second, and I believe we have an amendment.
Yes, thank you, Mr. Chairman. That is 015838.
015838, that's what I have. I need a motion. I have a motion and a second, so if there's no objection, let's go ahead and get that on the bill. All those in favor, vote aye. Opposed? Ayes have it. You are recognized.
Thank you, Mr. Chairman and committee. This bill is related to limited respite care services programs. These are exempt from licensure. That exemption was passed by this body back in 2018. And what this bill proposes is a modest increase in the number of participants that can be served at one time by a limited respite care service program, and also a modest increase in the number of hours per week total that would be commensurate with that increased number. And Mr. Chairman, we do have someone who would like to address the committee. And if I'm at the will of the chair and the committee.
Yep, I have them on my list. So without objection, we'll go out of order, or out of session. And let's see, is it Dr. Mike Glenn. And if you can, for the record, give us your name and who you're with, and then you'll get 3 minutes.
Okay. Good evening, Mr. Chair, and members of the committee. My name is Mike Glenn. I was a senior pastor of Brentwood Baptist Church for 32 years, stepped down about 2 or 3 years ago to work with the Engaged Church Network, which works with pastors and churches throughout the Middle Tennessee area. One of the things that we do when we work with a church is help them identify areas where they can solve a local neighborhood community problem. More and more, we're finding out that people with dementia patients and their family have limited access for a lot of different reasons to care for their patient. Sometimes they simply can't afford it. Sometimes it's not in their county where it's convenient for them. Local churches have an opportunity to provide anywhere from 4 to 5 hours a day of care for a patient so that the caregiver can go to the bank, so the caregiver can go to a doctor's appointment. Dementia care is 24 hours a day, 7 days a week, and many of our families are dealing with this. The church steps in as neighbors help neighbors and provides a couple of hours for the caregiver to take care of their own needs. Now, let's be clear. We're not taking care of medical needs. We're not passing out medicine. We're not providing any kind of medical care. This is simply a way for neighbors to help neighbors and communities to help each other in dealing with this growing problem. I'm now telling churches, if you do not have a dementia care program, you will. It is growing that fast in the state of Tennessee. This is a great way for churches to be able, this is a modest increase in the number of people who are impacted and who are available for care. So I would urge your support and would be grateful for it. Thank you.
Thank you. Do we have questions while we're, okay, Chairman Williams, sir, if you would just stay there, we got questions for you. Chairman Williams, you're recognized.
Thank you, sir, for your service. This bill in subcommittee, I had a little bit concerned about it regarding the ratios of persons that are providing the care to individuals. When you say that you communicate or assist churches in creating these kinds of programs, are you at all concerned about security as it relates to Alzheimer's and dementia care? For instance, if you go to visit my grandmother at an Alzheimer's dementia care place, I have to have someone scan me in. I have to have someone scan me out. We
most
passed laws
churches-
as it relates to Silver Alert because
Right.
a lot of our Alzheimer's and dementia patients get lost,
Right.
quite frankly. And
Most
so,
churches would have some kind of identification process that they would use in the nursery. So the right parent picks up the child out of nursery. That would be easily adapted for this. Background checks are a matter of routine now for churches. So I think most churches would cover that pretty quickly.
You're recognized.
yeah, I guess what I'm more concerned about is the example of us having to put a deadbolt lock on a door that was keyed on both sides so that
Mhm.
someone couldn't leave. Based upon my understanding of churches, most churches don't have that kind for security purposes, don't have that kind of security. My concern would be not that the care wouldn't be there while they're in the facility or that they wouldn't be seen, but if the ratios aren't right, what if someone were to vacate the premises while they're under their care? That would be a concern that I'd have, and just wondered if you're counseling those churches as it relates to that, because it is a ever-changing landscape as family members care for people with Alzheimer's.
Security has
dementia care.
become.
Sir,
I'm sorry.
you need to be recognized. If
Oh,
you
I'm
don't mind.
sorry. I'm sorry.
So you are recognized.
I'm sorry. Security is an increasing issue for churches as far as security, what doors are open and when they're open and who can get through and at what time. The accountability here is neighbor to neighbor. I'm leaving my patient with somebody that I know. I'm leaving somebody in the care of someone that I know. and who will look me in the eye about the care of my patient when I come back.
You recognize?
Thank you. And I don't think you're avoiding answering my question. The question was, do you communicate with the churches about a security protocol?
Oh, yes.
I'll give you an example.
Sorry.
In my community, a current governor, a candidate for governor's mother had Alzheimer's, and I found her walking in our neighborhood. I escorted her back to her residence. My concern is that when we were communicating this is adult daycare for people who can take care of themselves, which Alzheimer's patients can. I just am concerned about them vacating or absconding from the premises when someone is not watching.
You recognize?
Okay. My mother had Alzheimer's, and so I dealt with this the last 4 years of my mom's life. Alzheimer patients can be very creative in escaping or doing what they want to do. So I don't want to go on record as saying I can tell you 100% that will never happen. Just the nature of the beast. I will tell you that when the church is being the church, we receive that person as if we're receiving Christ himself. And we will be totally responsible for the well-being of that person while they're in our care.
Thank you.
Okay. Any further questions while we're out of session? Oh, Gillespie. Okay. Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. So my question is this: if we're going to increase the capacity of these facilities by 33%, are we also increasing the number of staffers or people, church volunteers or whomever are going to be there working with them to accommodate those ratios?
You're recognized.
Yes, I'm sorry. Yes, sir.
Okay, thank you, Mr. Chairman.
All right. Any further questions while we are out of session? Okay, seeing none, we'll go back into session. Thank you for your testimony. All right, Representative Gillespie. Well, before I get there, Representative Slater, do you want to address any of the discussion?
Thank you, Mr. Chairman. And yes, I would like to address some of the discussion. First of all, I'd like to establish the fact that the bill, and let me speak directly to the bill, the language of the bill and what is already currently in statute. First of all, in statute now, and what this bill also reiterates, is that these programs are programs with the sole purpose to provide to primary caregivers of appropriate adults with relief from normal caregiving duties and responsibilities. That appropriate adults is then defined a few spaces down in subsection 1. So it has to be an adult who can function in a group setting. So it's not anyone who has dementia or anyone who has Alzheimer's. The individual has to be able to function in a group setting. And then number 2, this adult has to be able to feed themselves without any assistance and use the toilet themselves without any assistance as well. So we're not speaking about any adult at any stage of Alzheimer's or dementia. In fact, the legislation refers to those that may have some memory issues. In working on this bill, my family has never had to care for someone who has been in that situation. We're very fortunate. Every family has those tragedies in family, but our family has never had to deal with that. In working on this legislation and in even speaking with members, I'm aware that there are members of this committee who have experienced this and who have concerns. Let me speak to the concern about ratios, for example. In subcommittee, that came up, and so that's when we added the amendment. And this amended version of the bill makes it so that these respite care centers, these exempt centers, will have at least the same ratio as other adult day service centers do. I can only speak to the one that I have visited. Currently, there are 6 across the state. So there are only 6 exempt centers. As the gentleman testified, I do hope that there will be more. So I hope that there will be more churches and other ministries that will step up and care for their neighbors. So I do hope that there'll be more. In the center that is in my district, their ratio is 4 to 1. That is a tremendous ratio in comparison to other day service centers that are licensed, that can be as many as 16 to 1. So I would just say, as far as the ratio situation is concerned, I think that that's important to note.
Right.
Thank you, Mr. Chairman.
Thank you. Representative Gillespie, you're recognized.
Thank you, Mr. Chairman and sponsor. You and I talked a little bit about this very briefly. I worked at a long-term care facility for many, many years that had a memory floor that Representative Williams was referring to, that has a very strict protocol of you sign in and you sign out. The doors are physically locked. All the doors, the fire escape's locked. Everything is locked from the inside out, so that people cannot leave. The facility that I worked in also was fenced, gated, and had a guard, multiple guards. And there were occasions where people still got off the memory floor. It was the 4th floor, 2 elevators, 4 locked doors, still somehow managed to do it. Fast forward, I lost my dad to Alzheimer's last year in the fall. And so I'm completely for what you're trying to do, but I have some serious concerns upon talking to some of the skilled nursing facilities that I know, and having worked in one. So for that, I just wanted to say my piece there. Thank you.
You're recognized.
Thank you, Mr. Chairman. And I remember when you lost your dad, and I know that that's very difficult for sure, and it's still very fresh in your mind. I kind of feel like the financial advisor who says that past performance doesn't guarantee future results. Let me share with you what has taken place since this exemption was passed by this body in 2018. I spoke with Department of Human Services, and in those 7 years, there has not been a single participant complaint, nor has there been a single family complaint to the department. I did a little math. My math may be off, but I took 6 facilities, 7 years, 50 weeks out of the year, and 15 participants. These would not be unique participants, but that comes to 31,500 participants, individuals who have been in the care of these exempt facilities. Now, if my math's off a little bit, 31,500 is quite a bit. And not to have a single complaint from a family member or from a participant is pretty strong past. There's no way that we could ever guarantee that there may not be some type of a tragic situation. I would say that accountability was mentioned in the testimony. And though there is great accountability when it comes to a church or a ministry helping neighbors, this does not take these exempt facilities out from underneath the department from the department. Let's say that there was a complaint, which, as I mentioned, there has not been in 7 years. Let's say that there was a complaint and it was substantiated. What the department would end up doing then would subject that particular ministry to a safety plan. So there is oversight still from the department. And so with that, I'm ready for any other questions.
All right, Representative McKenzie, you're recognized.
Thank you, Mr. Chair. And we've talked about this a lot in subcommittee, but as my two colleagues discussed, one of the things that concerns me is colleague from Shelby County talked about a floor that was designed for memory care patients, and they still, it's not 100%. In this case, I think I heard the guest talk about most places, most churches do have a badge in, badge out process, but there's no requirement for them to have any kind of positive controls on who goes in and who goes out of this piece of legislation does not require that at all. And that's extremely concerning to me, is that nothing in this bill does that particular function. So could you speak to that?
Thank you, Mr. Chairman. And yes, I would, in my comments would be similar to the comments that were made in subcommittee as well. These are ministries and these are churches. Churches in this day and age do have different protocols, but the government does not, the state does not step in and say, okay, you have to have these particular protocols in place for your church nursery, or for your vacation Bible school, or for your parents' day out, because there's an understanding that churches and ministries step up and help their community and help their congregants. And so that would be my response to that. I'm not looking for greater rules and regulations. I once again point back to the fact that these have been operating since 2018 without incident. And once again, that's not to guarantee that there could not or would not be an incident, no matter how many safeguards has already been mentioned by our colleague from Shelby County. No matter what restraints you put, there still can be an incident. So we're not guaranteeing no incident in the future.
Representative McKenzie, you recognize.
Thank you. So, to say that, to me, that's an apples and oranges kind of a conversation, as these exempt respite facilities were designed after the piece of legislation was passed, was designed for that. That's not what we're dealing with here. We're dealing with facilities, albeit I'm sure beautiful facilities. These facilities were not designed with memory care at the forefront. So to say that we didn't have any complaints from these 6, that gives me no assurance that this class of facility is going to mimic that in any way, because those facilities understood what they were undertaking prior to opening their doors to some of our most precious and really vulnerable citizens. So that to me is, I get the intent. I definitely feel the emotion, but in terms of moving forward with, I think the speaker said maybe a proliferation of these is, as he said, all of them are going to have it without clear guidelines and clear engineering on how we're going to manage these spaces, and then who's going to manage them, what their training is. There's nothing that says other than the manager has to take any training. There's no preparation. You got the ratios, but you got only one person in the building that has any kind of training, responsibility, and understanding on what's going on. Everything else is hope. We hope we're going to do a great program, but there's nothing to create an environment where safety is paramount in terms of training and preparation and engineering and design. So that's my deep concern with this piece of legislation. Thank you.
You're good. Any further questions for the sponsor of the bill? All right, seeing none, we will be voting on House Bill 1495. Will the clerk please open the vote? All those in favor vote aye, opposed vote no. All right, clerk, please take the vote.
Mr. Chairman, you have 16 ayes, 2 nays, 3 present not voting.
All right, House Bill 1495 passes and moves on to calendar and rules as amended.
Thank you, Chairman and committee.
All right, that brings us, we're going to go to item number 18, House Bill 853 by Representative Renaud. You have a motion and a second. And I believe, do we have an amendment that rewrites the bill
Yes,
and drafting code?
13710.
Okay, we have a motion and a second on drafting code 013710. All those in favor, vote aye. Opposed? Ayes have it. We are back on the bill as amended.
Thank you, Mr.
You're
Chairman and
recognized.
committee. This legislation is a clarification bill to ensure that the Family Rights and Responsibility Act that this General Assembly passed in 2024 is applied consistently throughout Tennessee Code. The Family Rights and Responsibility Act affirmed a fundamental principle, and one of those was that parents have the right to access their child's medical records and remain involved in their child's health care. But unfortunately, not all sections of the code were updated to reflect that standard, particularly Tennessee Code 38-8-202, and that gap has created a real problem for Tennessee families. There is a recent case in Williamson County Court just very recently that involved a 16-year-old girl receiving mental health treatment. When the mother attempted to follow up with the facility about her daughter's condition, the provider refused to share any information citing this code, 33-8-202, and then took the case to court. That court ultimately ruled that the treatment records belong to the minor, not the parents, despite the Parents' Rights and Responsibility Act saying otherwise. This loophole effectively overrides the parental rights that we already said previously through the General Assembly legislation that that the parents should not have records withheld from them. So I'm just looking to correct this inconsistency in other parts of the code and clarify that all parents have rights to access their unemancipated child's medical records. And those records include mental health records, rehabilitation records, and prescription records in each of those sections. With that, I stand ready for questions.
All right, thank you. And as I said earlier, I was going to try to get folks that had some testimony. And so if there's no questions at this point in time, we will go out of session. And I have a Kayla Garrettson to testify. So if you can, for the record, provide your name and who you're with.
My name is Kayla Garrettson. I represent the Tennessee Freedom Initiative. We often look at legislation involving individual rights, parental rights, things of that nature. We are in support of this bill as amended. I want to commend Representative Renaud because she was able to work with so many departments, the Department of Mental Health, the DCS, just so many, and we were able to sit in all those meetings. And I think she came up with an amendment that I believe all the departments are deferred now with this amended language, and my group is still supporting it. So that's pretty awesome when we can find legislation like that. We're supportive of this bill because, again, we are trying to clarify in 2024, this legislature passed the Families' Rights and Responsibilities Act. And at the same time, there was another act being ran, that was the Cassie Rights Act in 2024. And so, again, these bills were literally moving at the same time. I actually spoke to the sponsor of the Cassie Rights Act and said, hey, the bill that you passed only allowed for parental rights to receive prescription records specifically. And then the Families' Rights and Responsibilities Act, the sponsor was also a co-sponsor of, and that allowed for parental rights to medical records. And so what this amendment is doing is bringing that Cassie Rights Act that gave the right to prescription records up to the standard of the Families' Rights and Responsibilities Act. So we're changing the word prescription records to medical records. And so when I spoke to him, I said, hey, is there any reason why we specifically said prescription records rather than medical records? You were the co-sponsor of medical record of the terms medical records as well. And basically what we came to the conclusion of is that the legislative intent was that parents would have access to medical records. And that the two bills coming up at the same time, it all just landed on effective dates. And because the Families' Rights and Responsibilities Act had an effective date, that was after that of the Cassie Rights Act. The Cassie Rights Act is the one that took precedent. So with that all being said, this is a clarification act to make sure that those parents have access to these records. And I just want to be very clear that any exceptions that are already recognized in law, so those being cases of physical abuse, neglect, if the physical safety of the child is at jeopardy, all of those are still going to be recognized. Those will remain in law. Any exceptions in the Families' Rights and Responsibilities Act will also remain in law. So with that, I support this bill and I look forward to seeing you all too.
All right, thank you. And if you will stay right there, we have some other folks that want to testify. So I'm going to hold all questions. I've got a Melody Klein up here. And is there a Margaret Benningfield? If you can, for the record, state who you're with and your name. And since I'm trying to, can you do this in 2 minutes?
Oh, yes.
Okay. Y'all will each take 2 minutes each, please.
So I'm Melody Klein. I represent the Tennessee Association for Marriage and Family Therapy. This is my 6th visit to attempt to testify against this bill from Knoxville, and I'm really glad to be heard today. Thank you so much. The critical component of confidentiality that this bill attacks is what allows us to do our work in mental health, particularly with 16 and 17-year-olds. Without trust, you cannot feel safe enough to talk about the important things, the things that allow us to report physical harm and abuse are folks being safe enough to share it with us. If they don't believe this is confidential, they will not share it and we cannot report it. Explaining those limits are one of the first things we do. And if we take this away from our 16 and 17-year-olds, as it's previously been provided for the past 25 years in statute, it will break the trust of the therapeutic relationship. This is not a parent reading a child's diary or text messages. This bill would give any parent, even an estranged one, access to every clinical note of every therapy session to use for any purpose that they desired. There are no limitations here, and that parent can accidentally leave it in a public place. They can choose to share it with relatives. They can post about it on Facebook, or they can use it in court proceedings to punish the other parent. This bill changes nothing about parent involvement in therapy. Currently, healthy parent-teen relationship clients will already gladly sign a release, so we share whatever is needed. And in fact, as a family therapist, we encourage families to be involved in therapy. We want parents and children to restore relationship, and we work from that privacy place to allow to get the things out of the way that let them do it. If this bill is passed, it will do harm to our families in the state of Tennessee because kids will turn to other coping resources when they do not have security in mental health.
All right, thank you. And Ms. Benningfield?
Thank you, Chairman Terry and the committee. Thank you for the opportunity to speak today. I'm Dr. Meg Benningfield. I've been practicing medicine in Tennessee since 2008 as a child and adolescent psychiatrist. Today, I'm speaking on behalf of the Tennessee chapter of the American Academy of Pediatrics and the Tennessee Psychiatric Association, representing physicians who dedicate their careers to the health of Tennessee's children. In addition to my role as a physician, I'm also the mother to 2 teenagers and a 4th-generation Tennessean. The health, welfare, and safety of families here in Tennessee is of utmost importance to me. Today, I respectfully ask you to oppose House Bill 853. Confidentiality in healthcare for adolescent patients is a core tenet of medical practice. In pediatrics, ethical standards require physicians to balance the rights and autonomy of our young patients with the rights and responsibilities of their parents to support their child's health. Adolescence is a time when youth need support of caring adults to consider options and to make important decisions. Pediatric healthcare providers are part of the community that supports adolescents in becoming healthy adults. In the ideal situation, physicians and other providers partner with our patients and their parents. However, in everyday practices, the circumstances are less than ideal. When teens face difficult situations, they need safe spaces to discuss their concerns with a provider they can trust. The medical literature is clear. When adolescents lack the assurance that they can receive confidential health care, they prefer to forego care rather than seek care that their parents might learn about. The risk incurred when teens avoid medical care is not trivial and is not limited to the individual patient. When youth do not seek care, they're less likely to receive care and appropriate screening for sexually transmitted infections or STDs. These undetected STDs impact the public health of our entire community. In some cases, unfortunately, teens decide that it would be better to end their lives than to face their parents' reactions to the realities they face. As a child and adolescent psychiatrist, I'm confronted daily with questions about confidentiality. Teens ask me if I will tell their parents about substance use, sexuality, or suicidal thoughts. My answer is always the same. My first priority is your safety. It's your parents' job to provide for you and to keep you safe. We need to work together to make sure you have the support you need to make good choices. In rare cases, it's necessary to keep a teen's care private from their parent. Current law allows for such privacy only when sharing information is reasonably likely to endanger the life or physical safety of the child. This promise is essential, and House Bill 853 would eliminate it. I want to tell you about a recent patient of mine who was admitted.
Ma'am, your time's up, but we're going to take questions. So Representative Mitchell, you are recognized.
Yeah, thank you, Mr. Chairman. Yeah, could you tell me the story about your recent patient?
Yes, sir. Thank you for the opportunity. A recent patient of mine was admitted to our inpatient psychiatric hospital after a life-threatening overdose on Tylenol. She revealed to the treatment team that she had been sexually assaulted by a peer. She was afraid to tell her parents. She asked us if we had to tell. We met with her daily and explored her concerns. In the end, for this patient, we were able to support her in telling her dad about the assault. We facilitated a family session focused on improving communication. Her dad started out angry. He raised his voice and he said some things that I cannot repeat to you in this committee today. That happens frequently, but this parent came around with the support and guidance of clinicians who were dedicated to the best possible care of his child. That's when it works well. In other cases, the parents with whom I work are not able to work through difficult feelings, and their actions pose a risk of further harm for a child. They might misuse alcohol or other substances, become aggressive or threatening, or even abuse the child. In these cases, having the ability to maintain an adolescent patient's privacy is essential to delivering safe and effective healthcare for my patients.
Representative Mitchell.
Yeah, thank you, Mr. Chairman. And could you repeat again who you're here speaking on behalf of today? I just want to make sure everyone heard that.
Yes, sir. I'm Dr. Meg Benningfield. I'm a child and adolescent psychiatrist. I'm here on behalf of the Tennessee chapter of the American Academy of Pediatrics and the Tennessee Psychiatric Association.
Thank you.
All right, Representative Travis.
No, Bo beat me to it.
Okay. Any further questions while we are out of session? I do have one question for you, and this goes to the, I guess, to the exemptions in the bill, and a concern or question that I might have, and the sponsor may be able to ask when we go back into session. But say you have a child that comes in and they're getting used to, or they're just trying to get a rapport with their provider, and they may not have expressed suicidal ideation or something along those lines. And if a parent comes in, I believe the exemptions are in here. There's risk. There's a couple exemptions in here, but I guess the question is, the way that I interpret this is that you would have to either hand over those or determine that you met those exemptions. There's not a time frame in there. How challenging would that be for you?
Thank you for the question, Dr. Terry. Routinely, I work with parents and children to negotiate the limits of confidentiality. It's our ethical practice to involve parents whenever possible, and parents' involvement in healthcare is essential to kids getting the treatment they need, unless those children's care is threatened by their parents' involvement. And I think the examples that the woman next to me shared are actually realistic examples of situations that we find ourselves in frequently when parents fail to support the confidentiality of their children's needs.
All right, thank you. Any further questions while we're out of session? All right, seeing none, we will go back into session. Representative Renault, you are recognized.
Thank you, Mr. Chairman. I'd just like to clarify what this amendment says. Notwithstanding subsection I, a child's parent, legal guardian, or legal custodian shall not access medical records resulting from the treatment provided to an unemancipated minor without parental consent, including treatment provided pursuant to these various codes. If the treating professional is required to report abuse of the unemancipated minor, and the treating professional believes that access to these medical records is reasonably likely to endanger the life or safety of the minor child. So there is already an exception in this amendment for if there is potential abuse or neglect, that the provider does not have to extend those medical records. And then it also preserved in this amendment is that there is certain treatments that are allowed without consent. And those would include some of the ones that were stated, such as STDs, contraceptives, drug abuse treatment, prenatal care, and other emergencies. So I'm not sure if the amendment was reviewed prior to some of the concerns addressed, but I believe those are adequately addressed in the legislation.
All right, thank you. Any further questions for the sponsor of the bill? All right, seeing none, we will be voting on House Bill 853. All those, will the clerk please open the vote? All those in favor vote aye. All those opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 11 ayes, 7 nays, 2 present not voting.
All right, House Bill 853 passes and moves on to calendar and rules as amended.
Thank you, Chairman and Committee.
All right. Thank you. And my apologies to some of those that aren't on this committee. I hope to maybe be able to get to you guys here, but I had made the comment that we're going to jump around a little bit, and some of the bills that had been stuck here for weeks, we're going to try to get to. So without objection, we're going to go to, do you want to do item, Chairman Williams, which bill would you like to? Okay. Okay. Okay, we're going to go to item number 32, House Bill 2290. You are recognized.
Motion.
You have a motion and a second.
Thank you. Chairman, I do have an amendment that also rewrites the bill, drafting code 016138.
Motion.
Okay. 016138. You have a motion and a second.
We do.
Okay, if there is no,
Motion.
yeah, we have a motion. If there's no objections, go ahead and put that on as it rewrites the bill. All those in favor say aye.
Aye.
Opposed? Ayes have it. You are recognized.
Thank you, Chairman, members. This amendment is not substantially different than the amendment that was passed in subcommittee. The only difference in this amendment and the amendment in subcommittee is that currently SART is the governing guidance as it relates to HHS, or the federal gold standard as it will for IVF. And this just says that if there's another SART-like entity that came along, that we wouldn't be creating a monopoly just for a SART certification. So this amendment would allow for other professional agents to be able to practice IVF. This bill does three things. It creates licensure for IVF, or creates licensure for IVF laboratories. It creates a certificate licensure for physicians who wish to practice IVF, and it sets a standard as it relates to testing for those SART guidelines. You may be asking, what is SART? SART is the Society of Assisted Reproductive Technology. What we found out a couple years ago is that IVF and the practice of fertility medicine can be practiced in this state without any licensure or guidance, except for that of just being a clinician, and the laboratories weren't certified either. 2 years ago, an IVF clinic in Nashville decided that they didn't want to practice fertility medicine anymore and locked the door. What ended up happening is the Attorney General had to act on the taxpayer dollar to be able to go in and reestablish that and protect the embryos that were in that clinic. What this bill would do through licensure would give the Department of Health the ability to intervene in the case that someone didn't meet the societal standards as it relates to IVF. This bill by no means limits IVF and the current practice of IVF across the states. Across this state, it simply codifies the standard guidance utilizing that society that the federal government has already said is the gold standard and the way that they should be managed. I want to take the time to say to TMA and the fertility clinics that I've visited over the summer, they are doing great work there, and they helped me draft this legislation to make sure that families and embryos and the process of IVF is protected and licensed in the state. With that, Chairman and members, I'm happy to answer any questions the members might have.
Thank you. Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. And one of the ongoing concerns I have with this, I raised in the subcommittee, and I'd hoped that it was going to be amended in this final amendment that makes the bill, but is on page 3 in the 68-1-2102 section with certification requirement. We're still giving the department the discretion to issue certification, even when a fertility clinic has done all the necessary things under this code and even followed federal guidelines. So given the department the discretion there is concerning to me. And I'd hoped that was going to be amended as suggested, but so that's a concern. And also, Mr. Sponsor, we had discussed the federal guidelines in the subcommittee, and you had indicated those federal guidelines are optional. Is that still your take on those federal guidelines?
You are recognized.
The federal guidance is the SART, the Society of Assisted Reproductive Technology. When the HHS determined what was the gold standard, they said the SART was the standard. Currently, all the majority of the facilities in the state are already SART certified, so they're already doing that, which is why we gained the support of it. All this simply does codify current practice as it relates to that society. As it relates to the language that you discussed in subcommittee, it's typical for the language to be drafted the way it is as it relates to these approvals. The Department of Health has, to my knowledge, not limited anyone's ability to practice a form of medicine once they meet the criteria.
Chairman Clemens?
Yeah, thank you, Mr. Chairman. And I understand that. I just, if our fertility clinics are doing everything that are asked, I don't think the department having discretion necessarily appropriate. I mean, we've got a Health Facilities Commission and that does whatever the heck it wants on any given day. So, and I know that's separate from the Department of Health, but that's still a concern of mine. Thank you, Mr. Chair.
Yeah.
Chairman Williams?
Thank you. I appreciate your comments. I do think that one of the biggest challenges that we have is that the practice of IVF and these different pathways to IVF have morphed dramatically since the first child was born in England in the early 80s. And so the practice of medicine has completely gone unoverseen by any just made suggestions at the federal level. All this does is take those federal suggestions, codify them, allow for licensure of laboratories. The inspections are still done the same way that they've always been done. Because we want to protect those embryos that are in those laboratories. That was one of the biggest issues they had. They didn't want anyone entering the laboratory other than their own inspectors, which makes perfect sense to me. And so all that guidance is simply being codified with this statute.
Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. I just want to thank Chairman Williams for getting into the details of this highly complex field, coming up with guardrails and efforts to protect the unborn little babies in the embryos, as well as regulating the practice so that it is at a highly professional level for those in Tennessee that are going to use this technology. Thank you.
Thank you.
Thank you, Dr. Kumar.
All right, any further questions for the sponsor of the bill? Seeing none, will the clerk please open the board for House Bill 2290 as amended? All those in favor vote aye, opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 15 ayes, 5 nays, 1 present not voting.
All right. House Bill 2290 passes and moves on to government operations as amended.
Thank you, Chair.
And would you like to take up item number 31?
I'm happy to. If you got time, Chairman.
Yes.
I do have
House Bill
I'll-
0398.
second.
You have a motion and a second.
I have an
And
amendment drafting code 016044.
we have a motion
In a second.
and a second on drafting code. Say that again.
016044.
016044. I have a motion and a second. And so if there's no objection that rewrites the bill, all those in favor vote aye.
Aye.
Opposed? Ayes have it. We are on the bills amended. You are recognized.
Thank you, Chairman members. This bill simply mirrors other state statute as it relates to EMS staff. It was brought to my attention that EMS came upon a horrific accident on I-40 in my district, and because a Good Samaritan was performing CPR on someone, they could not call the death of that person and move on to the next one because they didn't have the ability to do that. What this bill would allow for EMS to be able to effectively triage the scene and save the folks that they can save. And if there are some that are deceased, they don't have to go and render aid there until someone calls that. And so that's what this bill does. I'm happy to answer any questions members might have.
Okay. Any questions for the sponsor of the bill? All right. Seeing none, will the clerk please open the board for the vote? Voting on House Bill 398 as amended. All those in favor vote aye. Opposed vote no. All right. Will the clerk please take the vote?
Mr. Chairman, you have 21 ayes, 0 nays.
House Bill 398 passes and moves on to counter rules as amended. Okay, folks, let's go back to item number 21. Representative Stevens, House Bill 1887. Have a motion and a second. You are recognized.
Thank you, Mr. Chairman. I do have an amendment.
Okay, let me get myself in order here. You have a motion and a second on amendment. Let's see, we have drafting code.
016111.
I have 016111. We are in agreement. You have a motion and a second on that. Rewrites the bill. So without objection, all those in favor vote aye. Aye. Opposed? Ayes have it. On the bill is amended. You're recognized.
Thank you, Mr. Chairman. This bill will create a 3-year pilot program to allow for the establishment of one prescribed pediatric extended care center in Rutherford County, subject to licensure and selection by the Department of Disability and Aging.
All right. Do we have any questions for the sponsor of the bill? Where's this go? All right. Seeing none, we will be voting on House Bill 1887. Clerk, please open the board. All right, will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
All right. House Bill 1887 passes and moves on to government operations as amended. And I believe you have one more with this?
Yes, House Bill 2415.
2415. You have a motion and a second, and you are recognized.
Thank you, Mr. Chairman. There is an amendment on this one as well, 14653.
Drafting code 014653. You have a motion and a second on the amendment. If there's no objection, let's go ahead and attach that. All those in favor vote aye. Aye. Opposed? Ayes have it. Back on the bill's amended. You're recognized.
Thank you, Mr. Chairman. This bill requires the Department of Health to create a hospital security grant program to award to hospitals for the purpose of hiring off-duty law enforcement officers to serve as additional hospital security.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, will the clerk please open the vote? All those in favor vote aye. Opposed vote no. All right. Will the clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
Where does this go? All right, this as well passes, and House Bill 2415 moves on to government operations.
Thank you, Mr. Chairman.
All right, let's bring up item number 24, House Bill 2337. Representative McCalvin, you are recognized.
Thank you, Mr. Chairman. Longtime listener, first-time presenter in the committee. I do have an amendment, drafting code 015934.
015934. That rewrites the bill. If there's no objections, go ahead and put that on the bill. All those in favor vote aye. Aye. Opposed? Ayes have it. We're on the bills amendment. You're recognized.
Thank you, Mr. Chairman, and good afternoon, members. This bill simply is it should really, for all intents and purposes, it is a private act applying only to my county of Williamson, but the Attorney General thought it would be best to write it in general application, so here we are. What it says is that if we decide to sell our hospital in Williamson County with a 2/3 vote, the county commission can utilize the proceeds after debt service to fund a hospital, or sorry, not a hospital, but a school, jails, fix roads, what have you, whatever they decide to vote on. With that, I stand ready for any questions you may have.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, will the clerk please open the board for a vote? All those in favor vote aye. Opposed, vote no. All right. Will clerk please take the vote?
Mr. Chairman, you have 20 ayes, 0 nays.
All right. House Bill 2337 passes and moves on to calendar and rules as amended.
Thank you, Mr. Chairman and committee.
All right, thank you. And let's see, that's going to bring us, let's go to item number 30. Yeah, House Bill 1034. And you are recognized. And do you have an amendment?
I think it's traveling with it, sir, but let me double check.
Oh, yes, traveling. Okay, so you are properly before us. You are recognized.
Okay. Thank you. This bill was a bill that we started a year ago. I brought it before you, and we ended up taking it off notice and working on it with Chamber of Commerce, NFIB, Office of the Courts, and the music industry, and everyone who was concerned about non-competes. So I was double referred, so I'm in front of you all today, presenting it again. What it does is it just sets up reasonable time thresholds based on relationships, up to 2 years for employee non-competes, up to 3 years for distributors, franchise dealers, and licensees, and up to 5 years for the payment period for covenants tied to the sale of a business. And with that,
All right.
I welcome your questions.
All right, thank you. And any questions? I did want clarification, and I think you had sent me a message about this. You said this does apply to hospitals and physicians at hospitals.
That's right. It applies to all non-competes. It just sets up a framework. We had nothing in the state to set up frameworks. We were just relying on the courts to make decisions.
All right, do we have any further questions? All right, seeing none. Okay, will the clerk please open up the board for vote? All those in favor vote aye, opposed vote no. Will the clerk please take the vote?
Mr. Chairman, you have 18 ayes, 2 nays, 0 present not voting.
All right, House Bill 1034 passes and moves on to calendar and rules as amended.
Thank you, Chairman.
Thank you. And there was one other person I'd hoped that would be here that's not on the committee, but they're not. So no, that's not. All right. All other bills that we did not get to today will be taken up next week, rolled to next week. Seeing no further business before us, we are adjourned.